How is a forehead lift surgery performed? Good morning to everyone, dear friends. Today, I will share details on how forehead lift surgery is conducted. Before we dive into the surgery, let's talk a little about the theory behind it. Previously, especially before Botox was invented or aesthetic practices began, forehead lifts were common surgeries. After Botox became popular for aesthetic use, the number of forehead lift surgeries we performed dropped significantly. As we could address forehead wrinkles more easily with Botox, it has dropped sharply. We still perform forehead lifts. We do forehead lifts for patients who want them or have Botox-resistant issues. There are two techniques for forehead lifting. The first method is endoscopic. The second is what we call a coronal incision, which involves making cuts within the scalp up to these points, allowing for direct visualization during the procedure. Both techniques essentially operate in parallel. Perhaps the open method may have a recovery time that is 2 to 3 days longer than the endoscopic method, but we can achieve good results with both techniques. Today I will explain the open method. In the open technique, we make the incision about 2 centimeters behind the hairline. We then surgically dissect this region. In the forehead area, we weaken the muscles that create the lines when we raise our eyebrows. We weaken the muscles that cause the lines that form, especially here when we frown. And afterwards, we pull the forehead upwards. First, after closing the subcutaneous tissues, we primarily use stapler stitches to protect the hair roots in the scalp. And we conclude the surgery. These patients are discharged on the same day. They don't have to remain in the hospital. The swelling, redness, and rarely bruising that may occur due to the surgery resolve within a week, and the outcome is truly beautiful. Caution is needed in forehead lifting. Especially, it is important not to exaggerate the middle point upwards to avoid a surprised look. Sometimes, in certain cases, we can combine forehead lifting with eyebrow lifting. This means that when we extend the incision a bit more, we can also lift the eyebrow. This will also align with the patient's examination results and preferences. Thus, the forehead lift surgery, whichever method it may be, it's a nice surgery, whether done openly or not. It's a nice surgery, whether done endoscopically or otherwise. We can incorporate eyebrow lifting in both techniques. The extent of lifting depends on various factors. It is determined and shaped together with your desires and our suggestions. Regardless, we will resolve your issue. The key is to come in for an examination and communicate your expectations and wishes clearly.